Shin splints can be very tricky and they are extremely common. The absolute first thing that you need to do before you decide how you're going to go about treating your symptoms is to know, is this more of a bone injury or is this more of a muscle and fascia injury? Because there are very different things that can cause pain in your shin. One of the first clues you're going to get about whether or not this is more muscle fascia versus more bone is the location of the injury. So if your symptoms tend to be more on the inside of your shin,
this tends to be more of a blended injury where you're going to have both bony and muscle fascia involvement. For this, some soft tissue work and strengthening can be helpful, and since there's bony involvement, some degree of rest is also going to be necessary. When symptoms are located more on the outside of the shin, this is more of a muscle fascia injury. This area does well with soft tissue work, strengthening, and some degree of gait modification to help reduce how hard the muscles on the front of your shin have to work when you run. If your symptoms are on the front of the shin, this is primarily a bony injury. This is something that you'll want to see a doctor for. There's not very good blood supply to this area. This area doesn't tend to heal well. It's going to take an extended period of rest to get it better.